So these are the ICS Impulse goggles that we're going to use for VHIT. A few features on the goggles to note. Right here on the right side is a camera. There's only a camera on the right side. There is no camera here on the left side. And so you'll also see this lens here. Make sure you're not touching the lens or bumping the lens at all. We don't want to get it smudged or broken. And so what happens is the eyeball reflects off of the goggle here and is measured by the camera on the right side. So something to note with your patients too, if you have a patient who is blind or doesn't have a lot of visual motion on the right side, this might be a test that would not work well for them. So just keep that in mind. The other thing to notice here is we have a strap on the back where you can make it more snug. So we want this to be really snug on the patient's head. And so once we do that on the patient, we'll make sure to make that snug. The last part to set up is to use the goggle covers. So we've got a goggle cover here. On the back side, you'll see that it's perforated here in the middle. Make sure that you tear here. These are pretty solid. So if you don't tear it right on the perforation, it will not open. When you have these here, you're gonna have two little nubs on both sides. These are gonna line up on the back side of the goggles here. We've got a nub hole right there and a little hole right there as well. And so we're gonna line those up and just push it right in. Same here, we'll line it up and push it in. And the other thing to remember too is that make sure that this is flush. Sometimes this will get out of whack, and so we just wanna make sure to kind of wiggle that around until it gets into a place where it's really snug. So this is the setup for the VHIT goggles before we put them on the patient.